What do you think he needs to do to be successful? His approach. I'll start us off. So his approach has been really data driven. I think it's one of the things we appreciate. He'll help us to create a narrative, but it will be based on the numbers. So I think one of the first things he needs to do is probably two things. Is one, analyze his population. So he's now got this pretty significant population of these that these employers entail. And the second thing is analyze the cost drivers. Really crunch the numbers like an economist and come back to us and say, you know what? I know what drives the cost of this population. I know what drives the health of this population. So these are maybe two of the places to start. What are some things that you would offer as a suggestion to him where he could get started?
Yeah, I think you're right. I think he's always been very data driven, and I think that's a key to what he's going to work with this organization. I think the other thing is because, as you said, he's an insider. He really understands healthcare from the very basis of delivery. I think he can help look at the resources and what those companies have to bring to the table and say, where would there be something that I think could really make a difference? So not only looking at their population, using data to understand how can they manage their healthcare spend better, but then where could they focus some of the capabilities that they have, whether that's capital or it's technology or innovation like Amazon, and say, what could we really do to help make a difference? I think that's where, for the broader scale, that's where the opportunity is. I have no question he's going to help those organizations really manage their costs and their spend, and I think that'll be great. And then others can learn from that. Obviously, other large employers, but it's really about how can this collective, organization or venture, how can they really bring something to the table that can help change, fundamentally change what's going on in healthcare.
Yeah, and I'll close this out, and then we'll get to your story here. So, I like the choice of a doctor because I think he can reframe the conversation around health and not health care. And so when he's out doing town halls or whatever he's going to be doing to address the mission and the people, he can really reframe it around. This is about keeping people healthy. It's about keeping them out of the hospitals,
right?
Which is really, I think a physician is better suited to do. The last two things I would say to him is, find partners who believe in your mission, which I think is along the lines of what you're saying. There's a lot of great partners out there. But the last one it's more of me pleading with him, and that is open source your findings in your model.
Oh, so yeah.
Do it for, innovate around this group, and then, let's take it to every market. Let's take it, let's just take it around the world. If we're able to really bend the curve, the cost curve, the health curve with this population, it really becomes I know they don't want to be referred to it as such, but it's really a great sandbox, great resources, great technology, great leadership. I like the promise of it, and I think that's what we're hearing in the news stories this week is people like the selection. I think so. Yeah. Let's see where it goes.